Michael Steer is a licensed clinical professional counselor in Illinois and LPC in Georgia and Missouri. Um, he specializes in the treatment of OCD and related disorders. He is currently acting as the Director of Education and Training at Anxiety Specialists of Atlanta. And he is ensuring the administration of evidence-based treatment interventions, including CBT, ERP, ACT, and he is currently serving as BTTI faculty. That's the Behavioral Therapy Training Institute through the International OCD Foundation. And he presents at all sorts of conferences. He is the co-author of The Complete Guide to Overcoming Health Anxiety, which is a self-help book and therapist guide for treating health anxiety. It's a pretty awesome read. I definitely recommend it. And I would say pretty notably, I think this is the most recent development that Michael and his co-author Josh Spitalnik just put together the Overcoming Health Anxiety Resource Center. I've only just scratched the surface of all of the things that they have on there, but it is a pretty amazing resource. I don't want to spend too much time plugging all the things they've been up to, but I will put in the chat. It's really cool. There are tons of things on there. There's podcasts, there's articles, there are videos, there are all sorts of modules, there are support groups. There's I don't know, you name it, they have it on there. It's really cool. So I will turn it over to Michael. Michael, thank you so much for being here today. And I will clam up and give you the floor.
Thanks, Ben.
Yeah.
Let me just pull up the slides then. Oh no, did they go away? We were so prepared.
I know. That's how it works.
How it always works. Oh, I literally just have them up. Okay. Oh, there they are. Okay. They went on to a different one. I'll share my screen here and then just let me know if everybody can see this. Okay. Is this? Nope. I don't think that's sharing correctly. Okay. Hold on. I think I got it now. It always likes you to jump through some hoops. How are we looking now? Okay, cool. All right. Well, thank you, Ben, for the introduction, and thanks so much for having me to talk. Hopefully, what we can go over tonight is kind of just give a kind of a quick deep dive into some of the things with health anxiety. A lot of times when we talk about health anxiety, we use a lot of the same terminology around that we would use with OCD. However, there are some things that I think are important just to kind of consider that might be a little bit different or just some nuances to be aware of. So as we kind of get started, what we'll do is we'll go through, let me see if this will, there we go. So first and foremost, I am not a doctor. I'm not a medical doctor. I'm not in a position to give clients medical treatment advice. That's not my role. I'm a psychotherapist. And also I didn't want to learn all those big long names and all those anatomy classes. So when we think about, our role as a psychotherapist or being, if you are a person with health anxiety, we have to realize is that if you're working with a therapist, we just have to acknowledge that piece of like, we're not doctors here, right? In this case, unless you really are, but then that would not apply to you. So also doctor coordination is vital. So if you are a professional working with somebody with health anxiety, it's important that everybody's on the same page. Because there are some times where not only is there health anxiety, but there's also actual medical things could be going on as well. And so coordinating with those doctors and making sure that we have those open lines of communication can be really helpful. Some people have had multiple doctors, tests, and evaluations, while other people have avoided them altogether. So you might see one or the other, or sometimes people go back and forth, where sometimes they'll overuse the medical system, and then sometimes you'll see it where they completely outright avoid them. And also it's important just to note that it's appropriate and responsible to get new symptoms addressed. If they're prevalent, they're persistent, if they're new, if they're weird, if you wake up and your ears are bleeding, go to the doctor, figure those things out, right? And so what we do have to work on in terms of treating health anxiety is the idea that we're assuming that there's a relatively clean bill of health. If there's not, or if a person has completely avoided the doctor, that's probably going to be one of my first things that I want people to do, which is let's go get checked out. We need to make sure that there's at least a little bit of a foundation to work from. So today we're going to be talking tonight. sorry. We're going to be talking about 5 different points that I think are just important to consider, which is one, what is health anxiety, what isn't, navigating the medical system with health anxiety, scary health thoughts may be real but not reliable, 4, the role of rituals in health anxiety, and then 5, embracing a valuable life in the face of health anxiety. But I pulled a trick on you because when we think about what is health anxiety is actually not a real thing. Well, kind of it is. Like a lot of times we refer to health anxiety that includes a couple different things to just be aware of, which is one is there's one thing called illness anxiety disorder. And an easy way to remember illness anxiety disorder is it is a preoccupation with our health. However, there's usually not many significant symptoms that are happening. So this might be people that maybe they have a headache that kind of comes and goes, but they're really afraid that the headache is because they have a brain tumor. But there's not really any symptoms that are incredibly persistent or life altering. And this is what we call illness anxiety disorder. This is where we get into this piece of care seeking or care avoidance time. Sometimes people go to the doctor over and over again. Other times they may completely avoid going to the doctor. So that's illness anxiety disorder. We also have something called somatic symptom disorder, which is still the preoccupation with physical wellness and if medical health. However, there is usually a focus of there's usually significant symptoms that are occurring, and maybe in sometimes life altering in terms of like pain in a way that it makes it more difficult to be able to go do enjoyable things, et cetera, et cetera, et cetera. However, even though that these people they have maybe tried to go to the medical center to figure out what's going on, nothing has come back. They check out just fine, right? And so there's this piece of like there's a preoccupation with the health, but in somatic symptom disorder, there's much more prevalence of physical symptoms. A good way just kind of remember is like if we just look them back to back, both have disruptive preoccupation with health. But in an illness anxiety disorder, is either there's little or no symptoms. In somatic symptom disorder, usually there's significant but unexplained somatic symptoms. Oh, sorry. Sometimes if I click forward too fast, I forget if I just barely touch my mouse, it wants to move forward in the presentation. So also, there's other things that can kind of seem like health anxiety, but maybe not really. So, panic disorder is really a focus on some of the physical sensations that people have. But it's not in particularly that there's something medically wrong with them. Sometimes where it kind of walks that line is the heart, right? Where it's like sometimes it kind of feels like, oh my goodness, I'm going to have a heart attack, where you hear that a lot of times in panic disorder. But there is a little bit of a distinction of like panic disorder itself is not health anxiety. There's also OCD with health related obsessions, which is usually there's 2 things that I look for between OCD and health anxiety, which is one is sometimes the rituals become a little bit more dealing with magical thinking. So like, for instance, somebody might be really afraid that they're going to have cancer, but as long as they pick up their cup 2 times, they're good, right? That's a little bit more disconnected than I'm afraid I have cancer, so I'm going to go on Google and I'm going to look. The other thing that you might just look at when we think about OCD versus health anxiety is, are there other OCD themes present? So you might say it's like, okay, this person has health themes, but they also are really worried about contamination and they're really worried about things being just right. And so you might have more substance in the level of OCD. So if that was the case, I'd probably say this person has OCD with health obsessions, except besides from just saying that they have health anxiety. So just things to look out for when you start to see them. It's not necessarily emetophobia, which is, again, preoccupation with physical symptoms, but the ultimate fear is throwing up. And it's also not being diagnosed with a medical condition, because we can have anxiety around health, which is just what I described as like, we can get scary diagnoses sometimes. We can have uncertainties. I'm working with a client that they have some tests that are still out and they're really anxious about it. There's some catastrophic places there we go to our mind. However, being diagnosed with a medical condition can bring on its own stress and anxiety. It's not necessarily what we mean by health anxiety when we normally have a pretty clean bill of health. I try to separate these out into 3 different categories, which is, medical symptoms. We have physical symptoms. We also have psychological symptoms. So if you just take a certain symptom, like let's say you have some tension or tightness in your neck and your back, um, that is a sensation that we could have. Now you could filter that into these three different categories, which is, maybe that's some explanation of a medical symptom of maybe there's something really, really wrong with you that's creating these different sensations and this tension and this tightness, and it's kind of going down your arm. So it's kind of freaking you out, like, oh my goodness, is this a heart attack? Is there something wrong with me? That could be the explanation if it was a medical symptom. We also have physical symptoms too, which is, I don't know, let's say you were going through your house and putting things away and you're organizing closets and, because when it's like 3 degrees outside, what else do you have to do? And you're like putting things up and moving things. And the next day you're quite sore. That's not a medical emergency. That's still a real symptom that we could feel, but that's what we call a physical symptom, which is, well, it's rather explainable, and it really just needs some TLC to be able to manage. We just need to, put one of those little massager guys on or something like that and take it easy. And then also we have psychological symptoms, which is the ways that, actual sensations present in our body, but could be because of psychological factors, which is stress and anxiety can create a lot of tension in our body. And where do a lot of clients start to feel it? Kind of in the back of their shoulders and their back and all these different things. So, but what do we need to do with those types of symptoms? Well, we need to really, those are treated with psychotherapy, education, maybe psych meds, those types of things. So what's important to kind of think about these three buckets is when we're working with somebody with health anxiety, you can have a sensation, and understandably, the first place that people usually go is the medical side. Oh my goodness, this is something that's going to be really catastrophic that's happening. And as we work with them, it's important to understand that two things, which is one is the sensation is always real. It doesn't even matter if it's from a psychological place. If it's from stress and anxiety, it doesn't make the symptom fake, which I think sometimes is the invalidation that people feel is like, oh, well, this is not a real symptom. It's just because of anxiety. No, it's still a real sensation. It just might not be where you think it's coming from. And so if we can start to create a little bit of a distinction between these things, they all lead to a place of making choices about what we do with these, a little bit more intentional. We also talk about the TOs and Cs of health anxiety. So we think about the TOs and Cs, and I'll get to one of my favorite examples in just a second, is this is where we start to break things down like a trigger, obsession, and a compulsion. Now, this is where we get to that language that you're saying. It's like, wait a second, this kind of sounds like OCD. And it's like, well, even though the content may change, we could put any OCD theme into this formulation and it would work just the same. And so this is what we start to do with health anxiety, which is a trigger. It can be anything. It could be a symptom. It could be a news article. It could be a medical appointment. It could be that Instagram story where you see that person that got diagnosed with like some like really rare thing. And you're like, oh my goodness, like this can actually happen. Right. And then there's always going to be an obsession that happens after that, which is this, it's going to be the scary idea or the scary thought about what's occurring. So that might be the fear of having a cancer or ALS or some other kind of neurological disorder or heart attack, you name it. Like that can be the scary thought. And then a lot of times that's when people are falling into compulsions, which is what's the function of a compulsion? Well, it's anything mental or physical that we do to try to reduce that anxiety. So we might resort to, searching online or, checking our pulse or blood pressure cuffs or all those different things. All of them are designed to be able to do like what we were saying, the function is like to reduce anxiety and also to try to get a better answer about some of the concerns. So when we think about like triggers, it could be any of these things. Triggers are pretty common in terms of like, it really could be anything. And anything down to like fatigue, right? Is like that could be a trigger for people, which is like, I'm pretty sure on every WebMD search ever, which is like, it just might be like fatigue. Yes, that's one of my symptoms. And so we think about any of these things could be the possible trigger. But what's important is to come back to is, but what role does it serve? And the role of any of these triggers is that it just gets the whole process started. Now, if we experience any of these triggers, we're going to have these obsessions. And don't worry, I'll have, well, this is recorded, so you can pause the screen. I forgot about that part. So you can kind of pause and kind of see the different things that I have on here too, instead of just going through all of them. We might have all these, like unwanted thought or idea images. Sometimes people like they see the image of them, getting treatment or whatever that might be. And that might be any of these fears, a cancer, a stroke, or an aneurysm, or it might just be like the terror that the doctors are missing something, or a mental image of laying in the hospital, or little mental movies that might play through our brain. Any of these things could be, created from a trigger, and that's starting to be the things that really become anxiety provoking. And then when people get here, they go to compulsions, they go to rituals, which is the best attempts at this point of just being like, well, how do I deal with some of this just terror that I have? And it's really any mental or physical acts that attempts to feel less anxious. So that might be avoiding doctor's appointments altogether, just like what we talked about in illness anxiety disorder, or it might be, what they cyberchondria, right? Is Google and WebMD, or the new hot thing is ChatGPT. That's like, I think that might have started to eclipse like Googling at this point, but all of them are after the same thing, which is if I can just get some answers, if I could just feel a little bit more reassured, maybe I can feel better. Maybe it'll reduce anxiety, make me feel a little bit more in control. Although, unfortunately, it just kind of backfires. Did I put that in there twice? Oh, sorry about that. Okay. So, I think I was just reiterating. So when we think about the TOs and Cs, I always think of Scooby-Doo. And this is hopefully before Scrappy Doo, because I don't know if anybody's like a Scooby Doo, like actually watch it. Like after Scrappy Doo, it's just okay, like just not the same. But anyway, we think about every episode of Scooby Doo, kind of all plays out the same way. The monsters are always different. So sometimes it's like vampires and scuba divers and you name it. But every episode kind of does the same thing where, something goes missing or something gets stolen. The team tries to find them. They pull off the mask, the whole thing, right? And when we think about, what's important about working with the TOs and Cs is that we're really trying to work on the function of how these things operate instead of getting caught too much into the weeds of like, no, I got to look after this, I got to find the scuba diver. Because the problem is a lot of times when we think about health anxiety, it switches. People might really get focused on, oh my goodness, I have cancer. And then, maybe after a couple months, it shifts to it's like my leg pain hurt, my leg hurts. Oh my goodness, I have a blood clot, right? And if we get caught into that cycle of focusing too much on the content, it just kind of feels like we're playing whack-a-mole at that point. So it's really important to come back to the TOs and Cs to say, hey, I know we were really worried about cancer. However, now we're talking about a blood clot. This kind of seems familiar, doesn't it? And we can start to use the same strengths that we did when we think about one theme area to another. Number 2, navigating the medical system. If a symptom is new, prevalent, persistent, go get it checked out. I'm not a doctor. That is healthy and adaptive to do. Our first inclination should not be if a new, prevalent, or persistent symptom shows up to be like, well, I'll just deal with the uncertainty of just not knowing what this is. It's like, no, go to the doctor, see what's going on, right? If you're a clinician, coordinate with the medical team. If the symptom is familiar, minor, or fleeting, maybe that's the time we lean in. If we kind of have a pretty good answer about that, that might be the time to lean in. This is also where I think it's important to realize that this is for clinicians and for anybody that's here watching with health anxiety. Only you can make that call. I can't tell a person and be like, nope, you don't need to go to the doctor. Like, I can't, that's not fair for me to make that call. I can help guide you, maybe trying to decide if that's a good decision to make or not. But ultimately, I have had to come to the conclusion that if sometimes people, I'm really having this symptom, I'm really freaked out about it, I really wanted to go to the doctor, they could be missing something. And I can try to help somebody through that, but I also have to respect of like, hey, if that is really feeling like what you're driven to, go ahead. Let's talk about it when you come back and see what happened. Because the other thing is that that's not unheard of. People have like weird symptoms that happen all the time. They go to like 2 or 3 doctors, and then the 4th doctor, they're like, actually, this is going on. So we do have to remember is that the medical system isn't perfect. And we just have to really be in that position of working with the person to be like, is this the best decision we can make at this point? And what do you think you want to do with this? And so we really have to kind of find that line between pursuing symptoms and also accepting the unknown, which is challenging. It changes often. It's also important to kind of put out there and just make sure that we're all being aware of that. Not everyone has the same experience in the medical symptom, or a medical system. Sorry. So we think about whether you're a woman or in a minority population, your experiences may not be the same. If you don't feel heard, respected, or taken seriously, go find somebody that does. And so I've had a couple clients in my experience that it's not that they weren't getting reassuring answers from the doctor, they just felt like they weren't taken seriously. And that's not reassurance seeking. That is just not getting a good experience with a medical provider. So, what I usually try to walk the line between is that if you're not feeling like your symptoms are taken seriously and you're actually getting good answers, then we got to find somebody that does. Now, once you do, and you feel like you have a relatively trustworthy relationship with your provider, then that at that point maybe we can make some of those decisions about the unknown, right? But there is a bunch of research. I just put a couple different articles talking about like finding that race negatively impacted care, perceived respect, and the quality of service. And then also women were less likely to die or be readmitted if they're treated by female doctors, which was kind of shocking, right? And there's all of this research about how just people are treated differently in the medical system. So just as a provider or for somebody that with health anxiety, it's important just to kind of remember is that, we can't make the assumption that everybody's going to have the same experience. And so we really want to be mindful of that to make sure that we're taking that into account. Also validating experiences when we think about what is health anxiety is important. Symptoms are always real. Doesn't matter. Headaches are real. Pain inside's real. Back is real. I get a lot of times clients, whether it's from medical providers or sometimes family, that will say it's like, oh, you're just making this up. This is all just because of your anxiety. It's like, no, it's still real. These are still not fabricated. So this is where we start to walk the line that we'll talk about in another point is like, but just because something is real doesn't always make it reliable. So for instance, headaches are not always tumors. Pain in your side is not always your kidney, and back pain is not always an issue with your pancreas. It can feel that way, but it also doesn't make it less real, even though that may not be the distinction that or the conclusion that our brain comes to. So let's talk about scary health thoughts, because that sounds like a good thing to talk about, right? Scary health thoughts. Often our mind will come to catastrophic conclusions around our health. So we see our T's and our O's here, right? It's like we might have a headache, brain tumor. We might have chest pain, heart attack, tingling the legs, ALS, right? And there could be a lot of different triggers, right? Because even around ALS, whether it is like, oh, I tripped on the sidewalk. Oh my goodness, like, am I losing my coordination? All of these things, these are all the T's and O's that we might experience. So these symptoms are real, right? Headache, chest pain, tingling legs, all real. But do we ever question the interpretations that our health anxiety makes? There is this thing, and there's a lot of different cognitive tools that we can use with health anxiety. But one of them that I think is really important is what we call overvalued ideation, which is a kind of an unreasonable belief that a person holds with conviction, even though they may acknowledge that it's not true. So sometimes we get really locked into it. It's like, no, like this is a brain tumor. I know it. And that's really hard because we can get really kind of entrenched into that of like, no, this is the really scary thing. And so when we think about, just this example, so let's take this example. A patient walks into the doctor's office, appearing slightly fatigued and rubbing their temples. They explain that they've been experiencing persistent headaches for the past 2 weeks, describing them as dull, throbbing pain that worsens with light and noise. The patient mentions occasional nausea and difficulty concentrating, expressing concern that the headaches are affecting their daily activities. They also note that their family history of migraines, but they're unsure that that could be related. And the doctor says, oh, that's 100% a tumor. Okay, that seems completely ridiculous, right? Because when you think of that narrative and then you think of this doctor's assessment, you're like, hold on, we might be talking about a headache here. We might be talking about a migraine here. But I think what's important is this is what health anxiety does, right? It takes these symptoms and you're like, you're feeling fatigued. It's probably this. And that's that interpretation that we really want to start to call into question, which is, would we trust a doctor that says this? I don't know if I would. Arnold Schwarzenegger does not, because he said it's not a tumor. So we have to work on that piece of, this is if our health anxiety is making this assessment of like, this is what these symptoms mean, we have to start to call into question about those. And we start to do that with what we call a non-judgmental attitude, which is our health anxiety often creates judgments or narratives around these symptoms. So, they have a certain symptom, and it can happen in one in two ways, which is one is either a catastrophic outcome, or sometimes they just they have a judgmental attitude, which it's really a narrative about like how much they hate the symptom, or how they wish it would go away, and it creates a lot of stress in itself. So, um, well, we don't have a lot of people on screen, but that's okay. I'll just run through these examples for the sake of time. But just know that if you give the wrong answers to any of these, especially the first two, I'm secretly judging you. So, mushrooms, I could ask the question of good or bad, and the answer is clearly bad because they're disgusting. And anybody that likes mushrooms, I don't know, what are you doing? Those fungus. Just kidding. Mushrooms are not necessarily good or bad. They are fungus that grows from the ground, right? Now, how we interpret them, I don't like them. Other people might like them, but that's different than if the mushroom is good or bad in itself. Pineapple on pizza, also the right answer is it's delicious. But if for some reason you think differently and you don't think pineapple on pizza is good, I'm so sorry for you. But also, is it really good or bad? No, it's pizza with fruit on top of it. But our interpretations or our narratives around that might be, I like that. Maybe somebody else doesn't like that, et cetera, et cetera. And the third example, like a rainy day, you could say, is a rainy day good or bad? You know, some people might say, oh, I love a rainy day. Other people are like, oh, I hate a rainy day. But at the end of the day, when we have to think about like a rainy day itself is just precipitation falling from the sky, how we start to interpret or relate to some of those experiences is really important. So this is one of the things that you can start to do with some of these physical symptoms that we have, which is we start to call into question, if I have said symptom, where does my mind go? Does it go to a really catastrophic place of like headache, tumor, right? And it's like, whoa, what if we're non-judgmental towards our headache, which is like, oh, I am noticing a sensation. We can also kind of start to draw some curiosity around our health anxiety too, which is like, okay, how many times has your health anxiety said that this feeling is a tumor that was going to take you out? Being like, well, 3,500 times. Wow. And you're still alive. That's amazing. So, still health anxiety can say some really scary things. However, are we sure that we can trust it? So we start to go through this non-judgmental attitude to try to create a little bit of distance with these narratives, because sometimes these narratives can really start to initiate that anxiety process. So if I can lead somebody back to recognizing a sensation, maybe holding a place for that sensation of like, yeah, I am noticing that I have a pain here. Or I am noticing that my shoulders are a little tense, whatever that might be. We're trying to create a little bit of distance between the actual experience itself and how people kind of start to get swept away in that health anxiety process. And mushrooms are still bad. And goat cheese too. I didn't put that in there, but goat cheese, come on. Like, no, Ben? No, I don't know about that, man. It's too pungent. I don't know. Anyway, let's also talk about rituals. Now, when we think about rituals, we're also talking about a very OCD type term, right? But we're also thinking about like rituals are very enforcing to the entire cycle. We have to remember is some of them happen out here. So that could be Googling or asking a partner, be like, hey, do you think I'm okay? However, some of the rituals can happen up here too, which is thinking through things or hyper awareness of the body. Oftentimes become a ritual, right? Because we just keep thinking about what does that symptom feel like now? What does it feel like now? And we just get caught into that loop. And so we have to make sure that we're addressing and kind of talking about both of these factors. But we do have to remember is that rituals serve to reinforce the cycle of anxiety. And they also do something else that's pretty damaging, which is they take us away from valuable and meaningful activities. Because if somebody has a concern around a headache or their heart or you name it, and they, even though they know that this is probably nothing that's really serious, they spend the rest of their night searching on the internet. There's probably other things that were more valuable for them to do at that period of time than spending all that time on the internet. And so really rituals, I heard a phrase at one point, I can't remember who it was from, but it was quite good, was that, a choice to do a ritual is kind of a choice against their values. And I think that's really important to consider, which is engaging in health anxieties rituals is usually not really part of, really what we would want to, maybe spend our night, spend our time, et cetera, et cetera. So we start to kind of think about this topic of ritual prevention with health anxiety, which is, so how do we break this cycle, right? And get back to those meaningful and valuable activities. Um, one of the places I sometimes like to start, especially with health, which is like kind of acknowledging that you're kind of fighting a losing battle, especially when we start to think about like, if we're looking online, right? It's like, so if you look online, you're probably going to find like one answer, and it's probably going to spark like 17 other questions, right? Because you're always going to find some other thing that's going to be like, well, there goes that, now I'm concerned about this. Or sometimes I'll have people, it's like, well, it kind of made me feel better about my headache, but then somebody was talking about how they like had a toe infection, and like, oh my goodness, like maybe that's what's happening to me, right? And so we get into tangents with this, right? The mental side gets caught too, because we're essentially at that point trying to figure out something that I just don't think we can figure out at that point, especially in illness anxiety, because a lot of times there is a focus on this uncertainty about what's going to happen. Maybe I will have cancer. Maybe I'm not catching something. But what if I'm not catching something? But how are you supposed to figure that one out? Like how are you supposed to come to an answer to that? So sometimes I tell people it's kind of like if you were gonna like play a match against Andre Agassi, right? And it's like, well, I guess you could win, maybe. But I mean, most likely, even though if you really, really tried, he's going to beat you every time. Right. And so, but it's like, okay, but this time I could win. And so you go back and he mops the floor with you again. And you're like, okay, well, that was close. Not really. He probably was much better than you. And then you go out again and you're like, well, maybe this is the time I could get it. Right. And then he beats you again. And you just keep doing that over and over again. And you're like, this is exhausting. Yeah, I could be doing a lot of other things with my life. And so there always is this option of, have you ever thought about dropping the racket? Like, you don't have to play him. I know sometimes it's hard because you're like, oh, I could really beat him this time. And you're like, But if you haven't beat him in the last 900 times, which I don't know how you were able to pay Andre Agassi to play you in tennis 900 times, but that's besides the point. If you haven't beaten him there, like maybe there's other ways to approach some of our health concerns, right? Is like maybe we want to dig into them more, but at some points, maybe we need to drop the racket and recognize I might not be able to figure out what I'm really concerned about with this. There's also some barriers specifically with health anxiety that I see come often up, which is one is we have to recognize our bodies are noisy. They do weird things all the time. But with health anxiety, that kind of becomes a health anxiety nightmare because our bodies just being noisy for weird reasons start to become triggers. That then turns into really scary ideas of like, well, why in the world does my leg hurt now? Right. And then health anxiety decides to pop up and being like, well, obviously the only explanation to this is a blood clot. Right. And you're like, oh my goodness. Okay, here we go again. Right. So we have to kind of remember is that our bodies are just going to be naturally noisy. There's going to be weird things that go on. And if we can start to work with that to kind of recognize of like, okay, maybe there's just a lot of symptoms that can happen that are just kind of weird and strange and unexplained. And maybe I can lean into some of the unknowns about those too. There's also the catch-22 that starts to happen with noticing physical symptoms, which is like, sometimes we'll have a physical symptom like a headache, or maybe our foot is numb or something like that, or kind of maybe feels numb. And it starts to create a lot of anxiety because we start to get really concerned about that. The hard part is as soon as we start to feel more anxious, physical symptoms go up because we're having that physiological response in our body because of the anxiety. However, if you're really focused on your physical symptoms and then your physical symptoms start to go up, that's going to freak you out because you're like, oh my goodness, not only am I feeling anxious about this, but it's actually getting worse. My physical, like it's feeling worse. My pain is getting worse here, right? And we start to get into this escalating catch-22 of anxiety where physical symptoms increase, anxiety increases, and it just keeps stepping from there. So when we think about like we have to address that piece, and we can even go back to our medical versus physical versus psychological to start to make some intentional choices, which is like, okay, this is feeling worse. Do you think this is feeling worse because the medical symptoms getting worse or because you're anxious? It's like, well, chest tightness is a pretty common symptom with anxiety. Maybe I can go with that. And that's where we can start to work people out of the cycle. There's also zooming out on physical symptoms that can be really challenging. So I always think of pictures like this where you see like the really kind of in-depth picture that's really zoomed in. You're looking at it and you're like, I wonder what the heck that is. This is what happens with people with health anxiety. They take one part of their bodies and that is just like laser focused of like, what does that feel like? What does that feel like? What does that feel like? And of course, going back to our bodies are noisy. There's an article by Dr. Bromowitz, The Noisy Body. That's a great resource. And it's a short article, but they do talk about this like study where they were talking about they had one group of people, they told them to focus on a specific body part, and they told the other group of people, don't worry about it, just like go and do your thing. And when they came back, surprise, surprise, who was more focused and who reported more symptoms in that certain body part? The one that was instructed to focus on it more. And so when we think about like a picture like this, you might look at this picture and you might be like, wow, that's, I don't know exactly what it kind of looks like, a circle, maybe like is that coins, something like that. But when we zoom out and you're like, oh, it's a wrench. Okay, that makes sense. But that's what we want to start to be able to start to do with this process of health anxiety, which is if people are getting laser focused on something, I can still see that little picture in the bigger picture, right? I still know it's there, but we're also trying to expand our focus to focus on other things. So if somebody comes in and says like, oh man, like, yeah, this pain in my neck is just, it's really concerning me. I might also encourage them to do one of two things, which is either one is, well, what else is your body feeling like? Other sensations you're having, or how's your legs feel? How's your pinky toe feel? Always like asking people like how your ears feel. That always is one that kind of creates some confusion because they're like, I think they feel okay. But also we can also have them start to focus on things outside of their body too, which is we can make a place for that little picture that we get hyper focused on. But also if there's other things going on around you, can we focus on those too? And can we expand our focus to be like, well, actually, like right now I'm going to talk about health anxiety. So I better probably be more helpful to, notice the sensation I'm having and listen and make sure I'm paying attention to this. And I think what a lot of times people start to kind of see is maybe that's one of the exit points for how we can get locked into health anxiety. Also, I always like to kind of talk about the difference between attention and awareness, which is my Boston Terrier companions here. We think about like attention and awareness is an important distinction to start to talk about with clients with health anxiety, because we're going to be aware of a lot of different body sensations. We're going to notice, the tightness in our body, or weird tingling in some places, or we might even be aware of just like really scary thoughts, of like rare diseases, et cetera, et cetera. And that's awareness, right? However, attention starts to become a different process about like, but what are we going to choose to put our mind on, right? So for instance, if I was going to tell you to look at the Boston Terrier on your left-hand side, which I should be the one in the sun, at least it is for me. And if you really focused your attention there, you still know the other Boston Terrier is over there on the other side, but you're choosing to focus and pay attention to the side that I instruct you to, the sunny Boston Terrier, let's just go ahead and say. And so we can shift our attention to say, well, let's look at the sleepy Boston Terrier. That one's kind of cute. You still know the sunny Boston Terrier is there, but we can create this flow of attention from one thing to the other. The hard thing with health anxiety is that people are aware of their physical symptoms and they pay attention to them a lot. And so if we can start to kind of work on that process of saying, hey, you can't not be aware of a symptom. I've tried it. I've had clients that have tried it. Doesn't work. So that would be like me telling you, don't even know there's Boston Terriers on the screen. Like you can't do that. Like you already know. However, if we're going to choose to pay attention to that, or put our attention on something more valuable or helpful at that point, that can start to be a process that we can start to lead people to say, actually, let me, I'm noticing this symptom, and let me also focus on other things that are going on. And then 5, living a valuable life, because therapy is not just about reducing anxiety or lessening triggers or not doing compulsions. Therapy is also about getting you back into things that are really important to you and living a valuable life like you'd want. Because we also have to kind of remember is that um, oftentimes, especially with health anxiety, we spend so much time trying to avoid losing valuable things, um, losing, loved ones or people that we would have to leave behind if these illnesses were true, or all of these different things. We often spend so much time trying to focus and make sure those things don't happen, that we get so engaged in rituals that they already happen. We can't spend time with loved ones or hobbies or playing Andre Agassi. I hope it's not, maybe just tennis, not Andre Agassi. He's going to beat you all the time. So we have to kind of really sort of kind of focus on maybe a lot of the things that health anxiety makes you feel scared of. And once it actually takes you away from some of the things that you're most afraid of. So when you think about, like, a lot of times for people, it's almost like they're already living with the illness. So a lot of times when people come to, if I have a client come in and let's say they're really concerned about cancer, it's like they're already living with cancer. Like every waking moment is about it. They're looking things up. They're going to doctors. They're probably actually doing more appointments in doctors than a person that actually has cancer, right? So we have to kind of remember is that value or rituals have a cost. Even though they can bring down anxiety, they really start to take us away from some of the most valuable things in life. But I think what's also really important, just like this last point, is like, working with health anxiety isn't just about taking away negative experiences. It's not just about like not feeling as many headaches or not being as freaked out to go to doctor's appointments. That's good stuff. Those are good goals. And also, I want people adding positive ones. I want them talking about like, well, okay, cool. That's great. It's awesome. You didn't go to the doctor's appointment, even though, or, go into the ER, go into the urgent care. That's amazing. But I also want to know, what else did you do? You're like, well, I haven't played Parcheesi in forever and I got to play. And I'm like, awesome. Good deal. Because the hard thing is like, this is the chance you have to live. And so that's when we can actually engage in some of these activities. Okay, perfect. Should have enough time for finishing up and then we can take some questions. When you think about challenges and exposures, I usually try to separate these things out into challenges. One is activities that we can do that might be anxiety provoking, but I just kind of describe them as like it's in with the intention of gauging in life. So some of the challenges we might have right away would be, scheduling that doctor's appointment you haven't been to, or challenge maybe, um, sometimes with medication, sometimes that becomes a big concern because maybe somebody like wants to take a medication or they're like, oh, that might be really helpful. But they're really scared to, because of course, with health anxiety, there's always going to be a focus on what kind of side effects, how is this going to make me feel? Is it going to make me sick? And so it can be kind of an intention of engaging in life in terms of like, well, this is a really helpful and healthy thing for you to do for yourself. And so maybe we could really create a challenge around that. We also think about like exposures are a little bit more structured activities that we can do that might be anxiety provoking with the intention of challenging health anxiety and learning. So like, for instance, like, I just kind of gave you some examples of like challenges might be like going on a hike or volunteering in a cancer hospital or going to a doctor's appointment. Exercising is a big one because sometimes people really want to exercise, but they haven't exercised in a long time because they're afraid something's going to happen. And so that's a great challenge. And exposures might be like, even just like writing and looking at the word cancer could be an exposure. And the purpose of that is not just to freak people out, but is to recognize of like, but there's nothing about writing or looking at the word cancer that really needs to frighten us. It's a word, not actually having the thing. And so if we can have people engage with that material, the material that often they would avoid, we can help them be able to cope in more helpful ways and practice our ritual prevention skills to make them be able to teach their brain of like, I can look at this information. I can be watching TV and hear about a commercial where, it's like, if you have cancer, right? And then sometimes that really freaks. I don't need people freaking out at that point, right? And so if we intentionally engage with those things and practice our skills, we can teach our brain safety instead of the danger. A lot of times happens. To wrap up real quick, Ben already kind of mentioned we did roll out a new website, updated website. So overcominghealthanxiety.com. We have two sections of the website. One is the resource center, which can be used by people with health anxiety, professionals, you name it. And there's art. We try to. I'll once this video gets up, and I'm going to hold Ben to Friday because he said Friday at first. Just kidding, Ben. Whenever you get it up, I'll put this video up there, so then that way it's in our resource center as well. But it is really just all of our different videos that we've done. Me and my co-author and then co-developer of this, Josh Vitalinik, and just a bunch of different articles. We have some learning modules. We're coming out with some more. So just a bunch of free stuff to educate. There's another part of the website that we call the community. I'm sorry. In the resource center, there's also a free monthly support group, first Thursday of the month. So if you or clients or somebody like that, or if anybody here has health anxiety, we do have a free monthly support group that meets on Thursdays, 3 o'clock Central, 4 o'clock Eastern. But also in the other resource we have is what we call the community, which for a low cost, we have another support group. We just met this morning. It was amazing. We have Q&A sessions. We have like a whole interactive forum, which we don't allow reassurance seeking on. So no asking any of your peers about like, do you think this is okay? Because it's just going to prolong the part. So if you want to go check it out and kind of see what's on there, we're just really excited because not only is education about health anxiety really important, but the support to be able to find other people that are really kind of struggling with some of the same things is kind of hard to find. And hopefully we've brought that to that. So, and finally, I'll leave off. I saw this quote probably like a year ago. I don't know how I didn't run into it, honestly, before that. But this one really kind of struck me, especially when we're thinking about health anxiety, which is like fear does not stop death, it stops life. And when we think about health anxiety, I think there's something that really resonates with that is that whether you're struggling with health anxiety or you're supporting somebody with health anxiety, or if you're a treatment provider, the fear around our health doesn't stop death. It just stops us from being able to do valuable and important things. And so if we can take any of these things about maybe how health anxiety, we can start to change the tide with health anxiety, we can get a lot of those things that are really valuable in life back.